and gentlemen, we have two more sessions. One is the session that will start now with the round table, and we expect that after we heard the round table, it will be possible to distribute to you a piece of paper with some of the recommendations that have so far come out of the discussions which we had. And after that, you will have the pleasure of listening to Dr. Singh and Dr. Girolamo, who will bring the meeting to a close. But before we get that far, we shall, I think, want to speak and listen to our colleagues in the round table. They've been selected each for a special reason, because they not only represent themselves, but also represent a variety of organizations. Let me introduce them also in the order in which they will speak. We'll first have the pleasure to listen to Dr. Haro, who in fact has been responsible for the exploration of where European research should be going in general. And I think that the part that deals with child mental health is an interesting chapter about which he can tell us. It is the variety of scientists all over Europe who have participated in this. I'm sure that many of you have been involved in one form or another of the Romer project in which he has been leading. We shall switch after that to a different, completely different scene, which is a scene of a single country in which, at present, which is not a member of the European Union at all, but which fights to try to find its own way in the field of child mental health. This time, this is the country of Ukraine, and we shall have the pleasure of listening to Dr. Marcinkovsky, who will talk to us a little bit of where do they see the priority for child mental health, for adolescent mental health, and how does one deal with these kind of problems when the country itself is not at complete peace. And the next speaker whom we have is going to be another